Hey, welcome to another video from Skinny Medic. In this video, I want to do a review demonstration of the Tac Med Solutions Blast Bandage. This bandage is really awesome for what it's intended to use for. Now, obviously, this bandage can be used for a ton of things, whatever your imagination can come with. How to use this, it can be used for that. But this is intended for blast injuries, so like hands, arms, legs. These are some pretty gnarly injuries if you want to Google image that. They're not typically just a smooth cut amputation. There's like pieces blown apart, there's fingers hanging everywhere. They're pretty nasty. This bandage is going to help us wrap that stump, that injury, keep it a nice, neat package, help control bleeding, because not all of these injuries are going to require a tourniquet. So if we can just wrap the stump around and help control bleeding that way, this is going to work. Also for an evisceration, where the intestines are hanging out, this bandage is going to work well for that. So I'm going to demonstrate that. Can I show you some tips there? So like I said before, typically a blast injury isn't going to be just a smooth cut, something like this. It's going to be gnarly, like there's going to be chunks of tissue hanging off, stuff like that. So, but for this demonstration, all I have is this stump here to bandage. So we'll go through it. You have the bandage here. It's got a tearaway point so we can open up. And then you're going to have a paper covering that holds the bandage together. Now that we've removed the paper covering from the bandage, open up the nice big pad here. Even lets you know other side is going to be towards the wound here. So you got a nice large area to cover up the stump here. So you've got this large injury here that's a blast injury that's really gnarly looking. Easiest thing to do is to take and gather all of the injury into the pad. So come up underneath it, kind of pick up whatever skin, bone, whatever else is there attached, and then just kind of gather it all back up this way. Then you're going to have your bandage here that we can unroll. If you make one good turn on it just to kind of hold the bandage in place, I'm going to rotate this around so you can see it. There's an elastic Velcro here, so once you get like one good wrap around, it kind of helps hold the bandage in place. So you can see the Velcro is holding here, kind of holding our pad in place so everything's in control. Now that we've got our first wrap around, we want to wrap the end of the stump to help control bleeding. So we can wrap it and secure it in place. Once you finish your last wrap here, you have Velcro that's going to help hold it in place. Generally that's probably pretty good, but if you want to make it a little bit more secure, you got the clips here at the end you can secure. Alright, so let's say my poor guy here has an evisceration, has intestines hanging out. Pretty nasty looking wound. Typically not life-threatening just for the intestines hanging out, but they look pretty nasty, and we want to try to keep those intact for the surgeons as best we can. So what we can do, they have a little pocket right here that has a piece of plastic in it. You can open up the plastic. Pretty cool looking. Cover up the intestines. Okay, this is going to keep them moist, keep them protected. Then lay your abdominal pad over the piece of plastic. Now we can make this wrap a few times around our patient here to help hold it in place. Like I said, typically there's not a lot of bleeding here, so we're just trying to keep the intestines clean and keep them protected. I would be careful about how tight you wrap this, because you don't want to impede the breathing or hurt your patient's breathing, but we can still wrap it and secure it in place. So I hope this video helps. You never know when you'll be the first responder. Remember the right gear and the right training.